Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
So healthy adults aged under 30 in the UK will be offered an alternative to the AstraZeneca vaccine after evidence suggesting it could be linked to a very rare form of blood clot. Regulators say there's still no proof of a link, but out of more than 20 million doses already given in the UK, 79 people have suffered the clots and 19 have sadly died. Officials have stressed that the huge benefits of taking the vaccine still far outweigh the risk of side effects for the vast majority of people, saying the jab is safe, effective and has saved thousands of lives. In a London vaccination centre today, a steady stream of people patiently waiting for the Oxford AstraZeneca jab, every one of them willing conscripts in the government's battle against coronavirus. But there's a problem, as we reported on Monday. Pressure on the UK's medicines regulator has been building for days amid growing concerns about a potential very rare side effect of the Oxford AstraZeneca jab. Today, the watchdog insisted the vaccine was safe for all ages. But nevertheless, government advisers took the dramatic decision to offer people under 30 a different jab.
Adults who are aged 18 to 29 years old who do not have an underlying health condition that puts them at higher risk from serious COVID-19 disease should be offered an alternative COVID-19 vaccine in preference to the AstraZeneca vaccine where such an alternative vaccine is available. The medicines regulator revealed today that the dramatic change in policy arose from an abundance of caution. It said 79 people, predominantly women, reported blood clots after having the vaccine in the UK. 19 of those died, and 3 of the fatalities were under 30. Several being vaccinated today admitted to some nervousness.
This morning I heard they stopped for the children, and and this thrombosis coming up. He's a little bit worried.
She's happy to go ahead with it, but she was a bit stressed, because of the symptoms, what she might come down with afterwards. But yeah, she's happy to have it done still.
The two, that is the one I wanted. Whether it being the name Oxford made you feel, easier.
Senior sources involved in the decision told me restricting use of the Oxford jab would delay by at least a fortnight the plan to offer all UK adults a jab by the end of July. Politicians will also be worried about the potential impact on the release from lockdown.
To answer your question absolutely directly, I don't think that anything I have seen leads me to suppose that we will have to change the roadmap or deviate from the roadmap in any way.
England's Deputy Chief Medical Officer also insisted any change to the vaccine rollout would be negligible.
That, of course, is contingent upon getting the supplies that we expect to get of the alternative vaccines. This is a course correction, there's no question about that, but it is, in a sense, in medicine, quite normal for physicians to alter their preferences for how patients are treated over time.
In Wales today, a new weapon in the UK's armoury, the Moderna vaccine, the third to be deployed after the Pfizer and AstraZeneca jabs. 3 more are expected to be available later this year. But with 100 million doses of the AstraZeneca vaccine on order, Britain is very reliant on it. Several countries on the continent have already restricted use of the vaccine. One government advisor told this programme that Britain should have followed suit weeks ago. Europe's regulator said today that clotting was a very rare side effect, but gender and age weren't clear risk factors. And in the context of the thousands of deaths a day across the EU, the benefits outweighed the risks. For older age groups, the danger of death from COVID far outweighs the risk of fatal side effects from the vaccine. Health experts are keen to maintain public confidence as the threat of a third wave of COVID looms and to keep the risks in proportion. The UK regulator revealed today that around 1 person developed a potentially fatal blood clot for every 250,000 people vaccinated. The risk of being hit by lightning in the UK is 1 in 1.2 million. The number of people killed on the UK's roads in 2019 was 1,752. That's more than 1 in every 37,000 people. But the risk of dying after contracting COVID is far higher. The Oxford jab remains a linchpin of the global fight back against COVID, nowhere more so than in the developing world. One senior source involved in today's decision said any move to restrict its use there could end up leading to tens of thousands of needless deaths. Well, joining me now is Professor Anthony Harnden, who's Deputy Chair of the Joint Committee on Vaccination and Immunisation. Professor, we know that in this country, 19 deaths could potentially have been avoided. Should you have restricted this AstraZeneca rollout earlier?
No, I mean, it's quite clear that we needed to investigate this extremely rare adverse event very, very carefully. I mean, it's strongly possibly linked to the Oxford AstraZeneca vaccine. We're not certain yet. Both the EMA, that's the European regulator, and the MHRA, that's our regulator in the UK, have deemed this vaccine safe and effective in all age groups. However, we on JCVI look very carefully at other factors, which include the risk and the benefits of the vaccine. And for the vast majority of the people that we're vaccinated at the moment, and that includes those age 18 and above with underlying health illnesses, the benefits of the vaccine far outweigh the risks.
Well, I wanted to ask you, go ahead.
There is this very small group of the well under 30s that have been immunized at the moment, and they are predominantly those household contacts of immunosuppressed, those carers, and some health and social care workers that haven't been immunized yet. And because the benefits risk ratio wasn't as clear in this age group, we wanted to issue prompt advice that those people should receive an alternative vaccine wherever possible.
But I wanted to ask you about the cutoff point, because I wonder what you'd say to a 30-year-old female relative of yours, for example. Would you advise that they still get the AstraZeneca vaccine?
Well, what I would advise, Kathy, is that they wait till their turn. If they're well and they're 30, they won't be immunised for quite a number of weeks yet. And as this is an evolving situation where we're looking at this data as it comes in and trying to understand this very rare side effect in more detail, we will issue prompt and immediate advice as soon as we characterise it more.
So the age at which alternative... I'm just wondering, the age at which the alternative vaccines are on offer, that could change. I mean, the government charts, for example, don't distinguish between gender. So I just wonder if it's proven that women are more susceptible to this blood clotting side effect than men, would the risks of the jab potentially outweigh the risk of getting COVID for women aged 30 to 39?
Well, we don't know that yet. That's the problem. And this is why the regulator are poring over these cases in detail every single day. And as any new cases come in, of course, when you start looking for something, you do get a flood of cases which are identified. So I fully expect that to settle down over the next few weeks and it will become clear. But at the moment, there doesn't seem to be any strong sex link for this particular adverse effect within the UK. But there does seem to be a bit of an age gradient, which is why we've issued this precautionary advice.
But do you think the European Medicines Agency has got it wrong by saying continue rolling this out to the under 30s?
No, I think they've got it absolutely right, and they are closely aligned with our regulator as well, who have said that we can use this vaccine in all age groups. I think what you have to remember is that on JCVI, we often do this with vaccines. So, for instance, with influenza vaccine, we offer a different vaccine for the over 65s and the under 65s, and yet both vaccines are licensed for all age groups. So it really is both the regulator doing their job very effectively and us on JCVI doing our job incredibly effectively, which should give the public absolute confidence in our decision making for their benefit. Given that the data is changing the whole time and you're analysing that, and it could be that you end up having to say, well, people over the age of 30, shouldn't get this jab, they should get another one instead. Can politicians be absolutely confident about hitting that target date to offer a jab to all UK adults by the end of July? Well, as you know, Kathy, I'm not an expert in supply, but I do understand that there is sufficient vaccines of alternative types to offer everybody under the age of 30 who is well a different vaccine and still reach our targets more or less. There may be a slippage of a week or two after the end of July. That I don't know, but clearly we're on target at the moment. We've got a very, very successful and effective vaccination program. We've saved more than 6,000 lives. That's up to the end of February and more now. That I'm absolutely sure. And what we don't want to risk is infection rates rising as we all want to come out of lockdown and a large third wave because of people not wanting to take up the vaccine. The AstraZeneca vaccine is effective, it's safe, and the benefits far outweigh the risks in the majority of the population.
Just very briefly, is it possible that you could have the same issues with the Johnson & Johnson vaccine, which is delivered in a similar way to the Oxford AstraZeneca one in terms of blood clotting?
Well, that's a very interesting question, Kathy, and one that we don't know. But of course, you're absolutely right. And the Johnson & Johnson vaccine is a viral vector platform vaccine, a similar type to the Oxford AstraZeneca vaccine. We don't know whether this is specifically related to the particular type of platform that the Oxford AstraZeneca vaccine is delivered in, or whether it is actually more of a generic problem with that vaccine type. And that is something that we will be looking at with all the worldwide data very, very carefully.
Professor Anthony Harnden, thanks very much for joining us.
Thank you.
Well, Channel 4 News was the first to reveal on Monday that the MHRA was considering changing its guidance on the AstraZeneca vaccine. But again tonight, no one from the government would come on the programme, and neither were we able to ask a question at this afternoon's press conference. The Department of Health and Social Care last granted an interview to this programme 70 days ago. The same cannot be said for Jeremy Hunt, who chairs the Health and Social Care Select Committee and is a former Health Secretary. He joins me now. Thank you very much for coming on the programme again, Jeremy Hunt. Are you worried by the fact that the MHRA, has raised these doubts about AstraZeneca for the under 30-year-olds several weeks after the same doubts were raised in Europe by the German and the French health authorities and the EMA?
No, and I think what's very striking is that the message from the European regulator and our own independent MHRA is very similar. And what I was most struck by was what neither of them said today, which is that the Oxford AstraZeneca vaccine isn't safe for any age group. They both said it continues to be safe for all age groups. And I think that's the most important thing. And I think what we've seen today is both regulators reacting to the fact that new evidence has emerged. And I think the MHRA has done the right thing by being totally transparent about the new evidence we have.
But there's a real danger here, is there not, of mixed messaging? New results, new messages, new guidance, confusing the public and therefore lowering what has been a very high degree of vaccine acceptance in this country.
I'm not sure it is mixed messaging. I think the danger of mixed messaging is much more the case in continental Europe, where politicians have weighed in with their views before scientists have done their analysis. What we've done here is wait until the facts are clear and then taken sensible steps. But I think what we have in this country is a very high degree of confidence in the MHRA, our own regulator, because they have shown, A, that they act very fast. They were the first regulator in the world to approve any COVID vaccine from clinical trials. But secondly, they've also shown that they can make very big judgments, like the decision to space the two dosages, which in January, when they first made that call, was a very bold thing to do. It's now been adopted in many other countries. So I think they've got a lot of credit in the bank for getting these things right.
And even though there was quite a bit of politics from Europe around AstraZeneca at the beginning, it was the European scientists, the vaccine scientists, who first raised the alarm that is now being adopted by our agencies here. So they were ahead of the game on this one.
Well, I think the truth is that this evidence is coming in from all over the world, but the data on AstraZeneca was always going to be more reliable in the UK because we've given out so many more doses. And I think, what we've seen today is very sensible decisions by both sets of regulators, which say the vaccine continues to be safe, but there's no medicine that is 100% immune to side effects. And in very rare cases, there are side effects, but the vast majority of people will be much safer if they have the Oxford AstraZeneca jab than if they don't have it. And that's the key message. And I think British people are perfectly sensible and pragmatic, and they understand this is the kind of new data that emerges in a pandemic. So I think they'll take this in their stride.
As we saw in an earlier graph, you're much more likely to die in a car accident than, to be hit by lightning, to be killed by a vaccine, or indeed to be killed in an airplane. And yet, it is fear of flying that is something that people need to deal with. So what's the psychology of calming people down about the dangers of this vaccine, even if they're that tiny?
Well, I think there's two things. First of all, this has emerged in a period where the effect of the vaccine rollout is proven in the eyes of the British public. They know, as we heard from Professor Hunden just now, that 6,000 lives have been saved. They can see that the daily death rate has fallen now to around 30 on the 7-day average. In somewhere like France, which hasn't had the vaccine rollout, they've got 9 times more deaths every single day. So I think there's a high degree of confidence in the rollout. But I think the note of caution is that none of these programs are completely invulnerable. And we need to do the other things the other weapons in our armory against the pandemic, including the social distancing, including test and trace, and other things as well, because we've basically got to try every single thing if we want to get it under control and get back to normal life as quickly as possible.
Indeed. Jeremy Hunt, thanks very much.
A review by the MHRA, the UK Medicines Agency, has signalled what government advisers have called a course correction. Those under 30 are to be offered an alternative COVID vaccine to the AstraZeneca jab. Evidence suggests there may be a plausible link to extremely rare blood clots. The recommendation comes after the drugs regulator found that by the end of March, 79 people had suffered rare blood clots after vaccination, 19 of whom had died. So how has the age of 30 become the first point at which AstraZeneca is recommended, when other European countries are putting it at 50 or even higher? And is there a chance this could change again? Here's our health editor, Deb Cohen.
Young people aged 18 to 29 without health conditions are some of those least likely to be directly affected by serious illness caused by COVID, which is why today the advice about what vaccine they should be offered changed. Over the past few weeks, we've heard concerns about certain types of blood clots associated with the AstraZeneca vaccine, which has already been used on millions. And today, both the European and UK medicines regulators said the evidence that it may be a vaccine side effect is getting stronger. But they stressed overall the benefits outweigh the harms. So what's happening to people who do develop blood clots after the AstraZeneca vaccine? It may have something to do with platelets, tiny particles that help blood to clot.
So what we're seeing is that patients have blood clots with low platelets, and they have low platelets because they have developed an antibody against their platelets, and they are activating them. So the platelets are all going yippee and forming clots everywhere in a very aggressive way.
The overall numbers are extremely small, and COVID itself can cause blood clots at a much higher rate than those associated with the vaccine. But today, the Deputy Chief Medical Officer said the under 30s would be offered a different vaccine to the AstraZeneca one, where available.
The NHS has a message that we will get the right vaccine to you in the right time, according to the new JCVI advice. There might be a small delay sometimes. There might be a slightly greater distance that some people are asked to travel. But the NHS is all over this and understands the challenge. Vaccines continue to be the way out for the UK. They continue to be the way in which we can get our lives back to normal.
In medicine, clinicians balance benefits against the harms. These may be marginal for a person under 30. Their risk of serious illness from COVID needing intensive care admission is lower than in other age groups. But some UK regulatory data suggests they seem to have a slightly higher risk of blood clots. These are early data and evidence is still accumulating, as it is for all COVID vaccines, so there is some uncertainty. According to the analysis, benefits of the vaccine increase when the virus rate is higher, but data is still coming in. It's early days. While attention has focused on AstraZeneca, experts will be looking at other vaccines. The European regulator is looking at those using a similar technology.
The honest truth is we have no idea at this point what the mechanism is, and we therefore have to be completely open-minded about the possibility that we might see this or other signals with other vaccines as they come through. Most of these vaccines are entirely novel platforms. They've never been used in humans before.
Symptoms for these rare blood clots occur 4 or more days after vaccination and include severe headache, blurred vision, shortness of breath, and unusual bruising. It's not yet clear what the risk factors are, but there are treatment for those with these clots.
Everyone will be awake to the phenomenon, and so we will get patients diagnosed very quickly. And that is key. So if we can find patients who have thrombosis and low platelet counts, they also have slightly other changes in their blood, which also help identify them, then they need to be treated as soon as possible.
Today saw the launch of another new vaccine in Wales, made by Moderna. Experts advising the government said the advice not to offer AstraZeneca to under 30s shouldn't slow down the UK's rollout.
This policy change is quite unlikely to influence the overall rollout, simply because the majority of people under the age of 30 who are in good health will not in any case be becoming eligible for vaccination for yet a while. So I think there's a reasonably good chance that if the supplies do come through as expected, that this really won't disrupt things to any great extent.
As vaccine programmes roll out across the world, we'll learn more and more. But after tens of millions of vaccinations so far, experts still say for adults the benefits of vaccination far outweigh the harms.
Deb Cohen with that report, and we're joined now by Professor Stephen Reicher, a member of the SPI-B committee, which advises the government on ways of helping people to comply with interventions recommended by medical or epidemiological experts. Also joining us is Professor Jeremy Brown, a member of the Joint Committee on Vaccination and Immunisation, and Dr. Margaret Harris of the World Health Organisation. And Professor Brown, if I can start with you, perhaps from the JCVI. Some countries have stopped using AstraZeneca for those under 55, for example, Canada, and I think Germany has stopped them for under 60s. Sweden has put it on hold for people under 65. So why does our recommendation only affect the under 30s? Can you explain that difference that we're seeing?
Well, I can explain why we've decided about under 30s rather than an older age range, and that's based purely on the sort of risk-benefit analysis. So if you catch COVID and you're in your age group 20 to 30, about 10 people in a million will die. If you're 30 to 40, more like 40 people will die. And if you're over 40, it's 120 people will die. So you can see that the risk of having a severe infection, and those numbers are doubled for people ending up in intensive care and tripled or quadrupled for those ending up in the hospital. So the risk of getting a severe disease very much ramps up with age. And so compared to the risk of this potential side effect associated with the AstraZeneca vaccine, which is a few in a million, you can see that the ratio of the risk, the potential risk of the vaccine versus the risk of the disease, it's much more in favour of vaccinating people when you get above the age of 30.
Is that the same answer if I asked you about the difference between men and women? Because the risk, tiny as it is, does appear to be more prominent in women, but they haven't made that distinction.
Yeah, I think it's very hard for us to know about the difference between men and women, whether there is a true difference, because in fact, in general, more women have been vaccinated because the high proportion of healthcare workers and social care workers and people working in care homes are female rather than male. So in the younger age groups, it's been a higher proportion of women that have been vaccinated. So to get a true incidence of whether it's increased in women compared to men is going to be a little bit difficult for now.
And in terms of how this is rolled out, if I can go to Stephen Riker now, are you happy to have this clarified tonight? Does this make your own role with SPI-B easier?
Oh, I think today's announcement was very well handled. It was nice to see that it was handled by the scientists, giving clear and objective information without being obscured by too much political speak. And I do think there are two really important points that we need to hammer home. I mean, the first is that if today you had the AstraZeneca jab, it was probably the safest thing you did. It was probably more dangerous to have a bath. About 30 people drown in the bath each year. It was certainly more dangerous walking down the stairs. 1,000 people die falling down the stairs. And it was it was safer than having breakfast. About 200 people a year choke on their food. So it's an extremely safe thing overall. What's more, if we look at the news in the round for today and put things together, then actually there is more reason to believe that you are protected by the vaccine than that you might be harmed by it. So a study came out today showing that of those who've had severe COVID, 1 in 3, 33%, have mental health problems. So overall, if you look at the balance, actually the balance is becoming clearer in favour of the vaccines.
I think most of us understand the balance of risk and how that massively outweighs. But we just heard a scientist in Deb Cohen's package say it's really important that people can be awake to the phenomenon, that actually once it's spoken its name, if anyone, tiny as that is encountering symptoms, then they just get diagnosed more quickly. So it's helpful all round to have these things out. Would you agree with that?
I think the information is absolutely critical. I mean, when we started the vaccine rollout, in SPI-B, we argued that it needed to be accompanied by an information rollout of the same order. Now, I think we've done quite magnificently in terms of the rollout of the vaccine itself, in terms of the number of jabs that people have had. We haven't done quite so well in terms of the information rollout. So people haven't been given the information they need, both about the consequences and possible consequences of the vaccines, nor about the behaviours that are necessary in order to stay safe. And I think this is a very good object lesson in how important transparency is. If you fear that if you tell people negative news it will put people off, then danger is that it comes back to haunt you later, as indeed it is today. If you're absolutely open right from the start that the vaccines are very, very good, but we don't need to overstate them. They're not perfect. They will have side effects. There will also be adverse effects which correlate. If you vaccinate enough millions of people, then some pretty bad things are going to happen to people. And I think we've got to trust people more, be more transparent with information, not overstate the case, and then it doesn't come as a surprise, the sort of things that happen today. In fact, to me, one of the most interesting things said today by Jonathan Van Tam was the fact that he's not at all surprised by this. He expected that some things would come out, as indeed they do as we get more data. But overall, what we're discovering is how effective the vaccines are, how safe they are, and this whole process, I mean, this huge process going on because of a very few number of cases show how seriously safety is being taken. And I think those are the messages we need to press home.
Just before I come to Dr. Harris and we'll look at the worldview, I just want to pick up with Jeremy Brown on that question of transparency. Norway, Denmark, Iceland suspended the AZ jabs, the AstraZeneca jabs, almost a month ago after their government scientists expressed their own belief in that link. Now, at the time, it seemed that the European countries were dismissed for that suspension. Does it seem to you now that we were too hasty to judge and maybe that transparency earlier on would have been helpful here?
Okay, so what we did not like about the suspension was their rapid suspension in an age group where the risk-benefit would clearly benefit in carrying on with the vaccination. So many of the countries you've mentioned that have suspended the vaccine in age groups where the incidence of the disease is going up and the death rate is now like 1 in 1,000, 1 in 100, something approaching that order of magnitude. And by suspending the use of the vaccination, they have probably led to more deaths and morbidity and illness than they would have done if they carried on with the vaccine program. That's the issue with their rapid suspension in age groups where the disease itself is likely to cause very severe infections.
Well, let me pick up with Dr. Harrison, and thanks for your patience. But in terms of the rollout now, worldwide, which is clearly where the World Health Organization comes in, the beauty of AstraZeneca was that it was meant to be cost price and room temperature. Do you believe that any of what we're talking about today will affect that rollout in developing world economies?
AstraZeneca remains a beautiful vaccine, a real workhorse. As the other speakers have said, the importance of this information is that the safety system, the vigilance is there and it's working because we are getting reports and we're looking at those reports, looking at every one of them to understand what it means. But in terms of the rollout for us, the big issue is that the cupboard is bare. We need more doses.
And has the pause from any of those European countries helped COVAX get more of the supplies to developing countries, developing economies earlier?
To date, I couldn't say that that's happening. A little under 2 weeks ago, my Director General made an appeal to countries with surpluses to donate 1 million of the vaccines that we can use in COVAX. That's AstraZeneca and Pfizer-BioNTech. And to date, I have not heard of any of those vaccines arriving yet.
So you mean that they haven't? I mean, is that your way of saying they haven't?
To date, yes, we haven't got anything extra from the agreements that we had with the suppliers, and unfortunately, the supplies we thought we would have been delayed because India particularly is dealing with a massive outbreak, and they are using what they've got for their outbreak.
And when we talk about a country like India, which has got a much younger population, we've been talking about age-based risk today, is the lesson not to worry about vaccinating the young at all, or would you expect the Indian population to carry on vaccinating across the range as soon as they get the vaccination?
So we at WHO have identified very much the priority groups we want to see vaccinated first, and that's the health and social care workers, the frontline workers, the people who are exposed every day, so most likely to get infected, and of course the people in the older age groups because their risk of severe disease and death is so much higher. And then there's the third group, people with underlying disease. We see those people get very, very ill and are likely to die as well. After that, then countries prioritise. But those groups need to be vaccinated everywhere around the world so that we do not see these high levels of disease and death. I mean, we have lost over 2.8 million people to this, and some countries are recording horrendous daily death rates. And the vaccines, AstraZeneca included, have been shown to bring down that death and disease burden, and that's what we need them to do.
Thank you all very much indeed. Thanks for joining us this evening.